Hi there, I am going to use a balloon to show you how an effectively coordinated functioning core should work. Okay, so during pregnancy and birth, your core system is obviously going to change and be a little bit compromised. Therefore, it's really important to progressively reconnect with this core system after birth to help with optimal recovery. Okay, so a normally functioning core system would consist of your diaphragm, your breathing muscle, inhaling down, dispersing pressure, as you see here, in a 360 pattern into your core system. So your abdominal muscles, your rectus, your transverse abdominals, which wrap from the back to the front, and your pelvic floor would absorb that pressure. On your exhale, that diaphragm should recoil back up. Therefore, the pressure would recoil back up off the core system, so that pelvic floor should lift up. And this is when we should incorporate our pelvic floor exercises to lift and activate on your exhale. Okay, more on that another day. So what I'm going to talk about today is some common problems or barriers to effective core control and coordination, which might be causing you some unwanted symptoms such as pelvic floor leaking, prolapse, pain, those sorts of things. All right, so if we are not breathing, if we're not breathing effectively, your diaphragm is going to be nice and stiff, isn't it? Okay, so the pressure is going to be dispersed and constantly on, which means that your core system, your core muscles cannot coordinate and function, give you the feedback that you need to be properly stabilized and functioning effectively. So that means your pelvic floor also might have pressure down on it, and that also is not functioning like it should be. All right, so get that breathing. This is why breathing is so important, and that's one of our foundations of postnatal recovery in pregnancy exercise. Okay, you might be squeezing your abs, and we do this to try and flatten our tummy. We might be squeezing our abs in to try and hold a perfect posture, and you might be overtraining your abs, so you might do too much too soon on your abs, or the incorrect exercises, recruiting the incorrect muscles, which would put pressure here, pushing up onto that breathing system so you can't breathe effectively, and also pushing pressure down on the pelvic floor, so again putting you at risk of leaking, prolapse, pelvic pain, that sort of thing. Not ideal, right? You also might be engaging your upper abs, and again that's pressure down, that's pressure out on that lower core, so that poochy kind of look that is commonly known as a mummy tummy after pregnancy. So if you are recruiting those upper abs, which is unfortunately quite common, then you need to start trying to release those and get that whole core system functioning more effectively. Okay, and of course if you have that, you've got the pelvic floor trying to fight that pressure, and that might even cause overactive tight pelvic floor, which is not having that recoil, and that causes a whole host of problems similar as well. So as you can see, a great perfect core coordination with this whole core system is going to be helpful for your core recovery, core function, your stability in your everyday life, and to help keep you pain free. So if you're having back pain, for example, then maybe your core system is not functioning correctly. So stick around and I will help you or give you some tips to get improvements with these.